Hi, everybody. I'm Lisa Carlin. Welcome to my new show. Excuse me. Hey, Doc, what's new in plant-based medicine? Today, we have the amazing Dr. Kristi Funk, a board-certified breast cancer surgeon. And instead of having me introduce her to you, I'm going to have a bunch of TV celebrities introduce her. So I'll be back in a moment.
Please welcome, I love her name too, Dr. Kristi Funk.
Founder of the Pink Lotus Breast Center, Dr. Kristi Funk.
So, Dr. Funk, you say you have some rules for weight loss. What's number one?
Dr. Kristi Funk has dedicated her entire career to preventing and treating breast cancer.
And today, the doctor who helped save Angelina Jolie's life is teaming up with another champion in the fight against the disease.
You get all this confusing, contradictory misinformation, and you don't know the source half the time.
We've been told over the years that if you're on birth control, your chance of getting breast cancer increase. Is that true? Coffee. What about coffee? What about soy?
What about alcohol? Unbelievable, but very helpful. Thank you so much. That was great.
I've actually created the Cancer Kicking Summit. You can visit online video or in person in California to talk about what you can do to control this disease.
Yes, I love hearing that. Thank you.
And now, Dr. Kristi Funk. Welcome to my show.
Hey, Lisa.
Hi, it's so great to have you. You're going to do such a great job today because Kristi is not only going to educate you on the latest news. What is new in plant-based medicine for breast cancer surgeons?
You know what's new is literally plant-based medicine. Like, you can say that to a patient or a fellow doctor, and they actually look at you like, I know what you're talking about, or I've heard of that. I mean, some of the docs, I have no doubt, are still like, whatever, behind my back. But to my face, they're like, very interested, and that makes sense, and plants are powerful. So honestly, this is an accepted method of treatment. It's not something alternative. It's complementary. It is a lifestyle. It is the best way to live your life and avoid chronic disease.
That's wonderful. So let's start. We're going to talk about reducing breast cancer. And you say it's up to you because we have power, we have control. So take it away. Tell me a little bit about how did you come to this lifestyle? This is not something you learned in medical school. You practiced for a bunch of years before you learned it. Tell us a little bit about your story.
Yes, okay. I grew up in Southern California, tomboy, only girl in a league of 300 boys playing hardball, baseball at the park. So it was kind of in my blood to want to do something that you stereotypically think men do, and that was to become a surgeon. Although it was never my wild dream until I actually was rotating through different disciplines in medical school. I didn't even really want to be a doctor until I had an epiphany. In my second year at Stanford, I was studying psychology. And that's ultimately what I did major in. But I had an epiphany, like a inaudible voice that overtook my thoughts, just, you're going to be a doctor. And I was like, maybe I'll marry one, but I don't want to be one. And then right after that epiphany, 2 days later, I was on a plane to Africa to become a short-term missionary for the summer. And it was really in Africa that I was so impressed by how critical health is to the number one killer of joy, of everything that makes life worth living. And bad health makes for a miserable life. And it was there that I decided on a dime, like, okay, God, I heard you, and I'm going to go back and change course. So I became a doctor, med school, decided to be a surgeon, 5 years of surgical residency, 1 year of breast cancer fellowship in surgery at Cedars-Sinai. I trained in Seattle and then did the fellowship at Cedars-Sinai. And I still had no idea about the power of plants. Then, what was it now? I wrote my book 16 years into my surgical practice of breast cancer. I wrote Breasts, the Owner's Manual. And in so doing, I wrote the whole thing myself. So no ghostwriter. And I'm so grateful for that decision because I would never have probably taken such a deep dive into nutritional science to simply prove that the way I ate was correct, which then was largely Mediterranean diet, like lots of fruits and vegetables, lean meats though, like through the roof, chicken, turkey, fish, sushi, kid you not, 3 to 5 nights a week. My husband and I were probably radioactive, dying of mercury poisoning, didn't even want to know. Don't want to know because I'm not giving up my sushi, right? So that's how I ate. And when I dove into the science, I was like, oh, this is irrefutable. This is embarrassing that I could be this far along in my medical career and have no idea of not only the power in plants, but of the absolute disease causation that's infiltrated all of our animal protein and animal fats these days, and actually forever in the past, but just these days, especially laden with so many pesticides and chemicals and beyond the meat itself. So there are a couple of studies that hit me hard and made me say, done. Like on a dime, we changed, and I'll tell that story in a second. But I want to share with the viewers a couple of these studies, because if you're on the fence and sort of you're like a sometimes vegan, what pushed me to be 100% plant-based might help you remember why. So every time you chew and swallow a forkful of food, you're just chewing and swallowing maybe some organic chicken breast or leafy greens. But what happens is those become down to a cellular, molecular level, absorbed into the bloodstream, coursing through your veins, saturating every cell in your body like a little bathtub that it's sitting in. And that bath water, so to speak, is either screaming out pro-cancer, giving it what it needs to grow and multiply and divide and ultimately spread, or anti-cancer, quelling all of the things that cancer cells require to remain in existence and multiply. What am I talking about? Magical things? No, you've heard of them. Estrogen levels skyrocket whenever you eat animal protein or animal fat. IGF-1, insulin-like growth factor, we're going to settle on for a second. Free radicals abound. Your immune system gets hit. Angiogenesis happens, the creation of blood cells to these cancers. So this particular study looked at over 6,000 adults, and they were followed for 18 years, and they took a meticulous food log of what they were eating. And for those aged 50 to 65 years old who consume the highest versus the lowest amounts of animal fat protein, we had a phenomenal, unthinkable 430% increase in cancer and a 7,300%, like I can barely wrap my mind around what that means in terms of a times risk in diabetes. And when they did the research, they tied that into IGF-1. So IGF-1, insulin-like growth factor, is, Lisa, we'll go back a slide to the IGF-1 slide. There we go. So this is the antidote to IGF-1. So IGF-1, insulin-like growth factor, screams at everything to grow in your body. Grow, grow, grow. Well, that's useful, actually, because we turn over a shocking 50 billion cells a day, and they need to be turned over thanks to IGF-1. But in excess, it's not done screaming, right? So you've turned over your cells. Now what's it going to do? You grow atherosclerotic plaque in your arteries to your brain, in your heart. You grow fat. You grow cancer cells, multiply, divide, grow into the blood vessels, grow into the liver, the lung, the bone. It's all coming back to IGF-1. So how are you going to control this bad boy? It's you. The solution to oxidative stress, to elevated IGF-1, is what I share as a study with patients. Every time they say to me, you know, doc, I've got breast cancer now. I'm 68 years old. I'm overweight. I've been living like this forever. It's too late for me. Oh no, sister, it is not too late for you. There is this study that blew my mind. 50 obese women, not cancer, just obese women. They took their blood, dripped it on a petri dish full of breast cancer cells, and a few cells died because we all have some immune cell function working in our favor. Otherwise, we'd be dead. So those cells died. They measured their IGF-1 levels, and they measured the binding protein that snatches IGF-1 and retires it from circulation. Then these women went away and they followed the Kristi plan, a low-fat, high-fiber diet, daily exercise. Literally for them, it's like 30 minutes of just sauntering. This isn't like heavy-duty running, sprinting, marathon exercise. And they went away for how long? 12 days. They come back 12 days later. Measure IGF-1 levels, plummeted. Binding protein, skyrocketed. And best of all, took a new sample of blood, put it on a fresh petri dish with breast cancer cells, and over 90% of the cells died on the spot. These women transformed their blood into a cancer-kicking machine just by following a whole food plant-based diet.
Wow,
high fiber.
That is just incredible. That is just incredible.
So with that in mind, one day I had determined, I'm convinced, I mean, there's nothing more for me to have to know that I mean, you're talking about an overachiever here. So I always got an A+ and the extra credit, right? So why would I like be a sometimes vegetable eater? Like I was all in my mind. So, and I wouldn't want nothing less for my husband and my kids. They came home with kids, so I had triplet, Andy and I, when I say I, we have triplet sons who at the time were just shy of 8. And they came home from school and I go running down the stairs. I'm like, boys, come here. We run over to the fridge and I open the refrigerator doors with flair and I say, boys, we're going vegan. And they're like, yeah. What is vegan? And from that day on, that was it. We were all in, whole food plant-based ever since, 3 years now, and never happier and never feeling more empowered, not only in my personal life and in my actual body, but in my position as a friend and warrior for these patients, these women who come to see me. I have so much more to give than I ever had before. It's really given me just an emancipated amount of energy and power and excitement to come alongside women with and without breast cancer to help them become the healthiest people they can be.
Wonderful. That's and now, how long has it been since your family has been vegan?
3 years next month.
Congratulations. That's incredible. Okay, let's move on to the next topic. You were going to talk about the Laron family, the Laron disease.
Oh, Laron, yes, Laron syndrome. So this was just part of another thing that hit me. Like, what? There are people in Ecuador, largely that's where they are, that have been well studied, and they lack the ability to use IGF-1 in their body. So if I needed yet another kind of like nail in that coffin toward whole food plant-based eating, this study was it. And what they did was they followed these people for generations. And guess what? When you have Laron syndrome, because you don't have that big grow IGF-1 thing, you have medical dwarfism, right? So you have short stature. You don't grow. But nobody in the history of the world with Laron syndrome has ever had breast cancer, has ever had actually any cancer ever until 2 years ago when one person got ovarian cancer. So it's still phenomenal. And nobody has ever had diabetes, type 2 diabetes. So IGF-1 is required for all of our major killers, for not just breast cancer, but pretty much all cancers. Heart disease, your number one killer, stroke, diabetes, obesity, Alzheimer's. Get that IGF-1 down and you just might live forever.
Wow. That's right. That's right. And where do we find IGF-1?
So our body, our brain's super smart. It tells our liver how to make it and how much. So you don't actually need to consume it. But when you consume animal products, the response is, whoa, there's all of these building blocks. There's so much protein here. There's so much fat. Come on, the insulin goes up, and so does the insulin-like growth factor, kind of follows behind, and you just get an excess amount. And so it's too much. Your body doesn't need that for cellular rejuvenation and repair, and it goes into excess mode, making too much of whatever, right? Plaque or cancer cells, fat cells. Oh, importantly, you do not have this elevated response to plant protein. It is just animal protein, except if you want to overdo it with plants. In other words, soy is a fantastic source of plant protein. And if you have more than, we know from the science, more than 7 servings of soy daily on an extended period of time, you are going to bump up your IGF-1. So my strong recommendation about soy consumption is to 2 to 3 servings a day. It's so healthy. Like you should strive to get those in your body, but don't pass 5 because we just don't know. We know 4 is okay. We don't know about 5 and 6, and we know 7's bad. So I say 2 to 3, keep it safe. Do you want to talk more about soy?
So talk a little bit about the relationship between phytoestrogens and soy, and whether or not it increases breast cancer, which is what everybody wants to know.
And what everybody not everybody.
And also, I mean, gynecomastia and prostate cancer. So I hear it all the time from people that
I hear it all the time. And yeah, I'm so sorry to all of my patients for 18 years prior to my writing the book and becoming super smart, that I told you to spit that miso out of your mouth. I was like, we don't know what soy is doing. It has isoflavone. So I was smart enough to know they were plant-based. estrogen-like compounds in soy, but I was not smart enough to actually take the time to look into the research and know that what I was advising was absolutely wrong. But not only wrong, I was having them avoid something that would be super beneficial to their situation. So let me explain. There are two estrogen receptors in our bodies, alpha and beta. Turns out alpha is on the cancer cell. And with 1,600% more affinity, the estrogens in soy, like genistein, bind to beta. So what do they do when they hit beta? They do two things. They shut alpha down. So now it's basically blocking the estrogen receptor on a cancer cell, and it goes out into your fat cells where we have an enzyme called aromatase, which is busy churning other steroids, largely from your adrenal gland, like testosterone and androstenedione, into estrogen. So now it's inhibiting that enzyme. So you're decreasing the bad acting estrogen in your body, increasing this beta estrogen in your body with soy consumption, which improves bone health and decreases breast cancer by how much? 60%. Human studies since 2009, 8 of them, all across the board. High versus low soy consumption, 60% less breast cancer, period. Then if you have an estrogen-driven or estrogen-negative breast cancer, you will reduce recurrence by 30 to 60%, depending on the study, and death from breast cancer by 30%. For our men, studies vary between 30 and 60% decrease in prostate cancer formation. So this is an absolute health food when it comes to cancers. And interestingly, it even decreases estrogen negative cancer. So that's when you have a little estrogen receptor sitting on a cancer cell. When estrogen hits that receptor, it's going to send a signal to the cancer to multiply and divide. If you don't have that receptor, it's estrogen negative, and it's uniformly a much more aggressive, harder to treat and cure breast cancer. And amongst the estrogen negative cancers with high soy consumption, again, 30% less death. So it gets a bad rap in men. And people even ask me, they say all the time, wait, you don't give your boys though, because the 3 boys, a bunch of soy milk, do you? And I was like, oh yeah. I mean, not only am I thinking about those little tiny prostates in the future, but the idea that it produces gynecomastia is basically a sensationalized case report. It's a one-off of a guy who was drinking, I'm not kidding you, 3/4 of a gallon of soy milk every day for months on end. So yeah, if you go to excesses like that, a good thing, too much of a good thing isn't wonderful. Sorry, Mae West, but it is actually detrimental. So don't worry about, you don't get, gynecomastia, by the way, is man boobs for those who are a little bit confused. It's in men when the breast tissue that they have gets a little hypertrophied, a little plumper. And that's usually in response to the side effects of medications. A lot of heart medications do it. So antihypertensives do it, and Lipitor will do it. So, and it's sometimes from steroids, right? They're taking steroids to bulk up. They're bodybuilders and want to have more muscle. So they're taking a lot of testosterone, and that testosterone aromatase gets converted to estrogen. So they have higher estrogen, and that makes the gynecomastia.
I see. What about birth control pills? Can you talk about the myth regarding? It's
a myth with some truth, but it needs to be put into perspective. So here's the deal. Birth control pills obviously contain estrogen and some progesterone. And they do, in fact, across the board, 55 really good studies have shown that it does increase breast cancer, but a teeny tiny amount. By across the board, on average, 24% increase in breast cancer amongst birth control takers. That, as a single number, is probably like, did you just say teeny tiny and 24% in the same sentence? And the reason why, yes, I did, is you've got to look at risk across your lifetime. So who's taking birth control? Probably a 20-something, right? So between the ages of 20 and 30 years old, the chances of getting breast cancer in that decade of life are 1 in 1,567 young women. So a 24% increase makes that risk a 1.24 out of 1,567 young women. So you see, it is a really, really small increase in breast cancer risk. And you're probably way more likely to have an unwanted pregnancy if that's why you're on birth control. So I tell everybody on birth control just to not think twice about it. It really, unless you have extraordinarily high risk, but even then, like, who are we talking about? Maybe a BRCA, BRCA mutation carrier, very high risk, up to 87% lifetime risk. I want them on birth control. You know why? it decreases their very high risk of ovarian cancer in half once they take birth control for 6 years. So even they are on it. So there's no real reason from a breast cancer perspective to avoid birth control.
And then in your 30s, what do you suggest people use?
So same thing, because the risk is so small in your 30s. So between 30 and 40 years old, it's 1 in 220 women. And now you're talking about 1.24 in 220. It really doesn't elevate until you are going to not need birth control anyway because you're menopausal.
Okay. And then let's, in the video that I played before, one of the ladies talked about coffee. So do you have thoughts on coffee consumption?
I do. So if you love your cup of joe, do not worry. You can safely drink it. It does not cause breast cancer at all. In fact, it may decrease breast cancer. So here's the deal. It has caffeine, and it can stimulate breast cysts, which are fluid filled and can be painful. It can stimulate fibrocystic tissue in your breast, which might be annoying, but it's not cancer. So if your coffee doesn't bother your breast, it doesn't bother me that you want to drink coffee. The big thing about it is that it's rich in these anti-cancer compounds called phenols, and actually tons of lignans, which we're going to talk about in my smoothie recipe for flax seeds. But lignans are also in coffee, and they're very powerful anti-estrogens. And as you're probably picking up on by now, the less estrogen you have in your body, the less breast cancer risk, because 80% of all breast cancers are fed and fueled by estrogen. So coffee, get this, and it's a lot though, admittedly, it's 5 cups a day. So those who drink 5 cups a day had 59% less breast cancer than those who drank less than 5 cups a day in a big study. Then there was a huge study from out of Norway, and these 14,000 Norwegian women had 5 cups of coffee a day, and their breast cancer risk decreased by 50% with this cautionary tale of anyone who was obese, which in Norway is a BMI of 23 or above, doubled their risk of breast cancer. So high volume of coffee, if you are BMI 23 and above, should be avoided. We don't know why. Something about the methylxanthines maybe that interfere with the when you're premenopausal and you're obese. This is not a reason to gain weight on purpose for breast cancer risk reduction, but it turns out that premenopausal obesity is protective against breast cancer, but that all turns on its head ferociously once you get into menopause and are still fat. So that's just we don't understand the mechanism about why it's protective, but it has something to do with the ovarian function, and methylxanthines in coffee take away that protection from the ovaries. So now all that obesity is just pure estrogen fat related danger to your breasts.
So yet another reason to try to maintain a normal weight. We see that people that are normal, that have normal weight, have less are less sick overall with COVID, the COVID symptoms and diabetes. So if we can get our population to consume more whole food, plant-based food and get their weight under control and their diabetes in check, then their heart risk will be less. And look at that, their breast cancer risk will go down as well. So it's just so many reasons to do this. Let's talk about alcohol and breast cancer, because I know there's a connection there. So I wanted to discuss that. So
there are
what
a few
your
connections.
consumption?
Yeah. So alcohol, what's a drink? Pick your poison here. You got 12 ounces of beer equals 5 ounces of wine equals 1.5 ounces of hard liquor. If you drink a drink a day, you're going to increase breast cancer over the teetotaler by 10%. 2 drinks a day, 30%, 3 drinks a day, 40%, and so on. You can just add the percents from there. So what's going on here? There are 4 basic pathways, reasons why alcohol is going to lead to cancer. Not only of the breast, it's actually more strongly associated with cancers of the mouth and throat, the pharynx, esophagus, colon, rectum, liver. Those are all highly affected organs by alcohol consumption. The breast is affected because it increases estrogen levels, number 1, decreases immune system function. Obviously, your immune cells are running around fixing DNA when it goes awry or throwing it out. It increases a potent carcinogen called acetaldehyde that is mostly produced in the liver. But even if you just put it in your mouth and spit out that alcohol, like, why would you waste alcohol like that? But no, I'm kidding. But if you spit it out, the point is it's already been formed, this acetaldehyde, and you swallow it down. But when you look at studies of say the Nurses' Health Study. 83,000 nurses followed for 14 years. And when you pull out the alcohol consumers who have a drink or more a day, okay, so now we're looking at a subset of women followed 14 years who drink alcohol basically every day. Those who had high folate consumption versus low had 89% less breast cancer. I mean, an incredible drop. And then just amongst all women in this nurses study together, those who consumed just 300 micrograms of folate a day had 27% less breast cancer. So what is it about folate? So folate is its natural form. And it's essential. I mean, you've got to eat it or through food or supplements because your body cannot make it on its own, okay? A synthetic form is folic acid, but folate found in your leafy greens, broccoli, asparagus is going to get converted to something super awesome called methylfolate through an enzyme that sounds like a really bad word called MTHFR, which stands for methyl tetrahydrofolate reductase. Okay, so MTHFR, because the other thing is a mouthful, converts our folic acid a little bit and folate into methylfolate. Methylfolate runs around, fixes DNA, or throws it out when it can't be repaired. So methylfolate is really critical to stopping cancer cells because every cancer begins as one cell, becomes two, becomes four, and so on. So if you can stop it at this little micro level, you never even knew you had it. So alcohol inactivates MTHFR. 30 to 50% of us are born with a suboptimal, subfunctional MTHFR to begin with. And then when you throw some alcohol in there and you inhibit that enzyme, you're not getting the methylfolate buildup. And that is leading to the bump in breast cancer that we went through with a drink a day, 10%, 2 drinks a day, 30%, and so on.
And would that also be responsible for inflammation in the body?
Yes. Okay. So that's through the homocysteine axis. When you don't have the folate that I'm talking about, you're deficient, and you don't have B6 and B12. Those three things, when they're deficient, let homocysteine rise, and that's going to create inflammation and really impair your immune system. The opposite, though, those three things in abundance, not excess, just normal amounts of B6, B12, and folate together combine in your body to form glutathione, which is the most potent, powerful antioxidant we've uncovered to date. So a couple of secret weapons that I will throw out for those who are like, wait a minute, isn't like alcohol heart healthy? Unfortunately, the newest literature is a little mixed on that, but there's enough out there to say it might increase HDL and decrease LDL cholesterol levels, leading to less heart disease. And I'm not going to make any bones about it. It's definitely, a class 1 carcinogen, but on that list of class 1s, there are things more potent than others. So we all know alcohol is very ubiquitous across all continents and cultures, and people could drink less, should drink less, probably, especially in COVID times. But here's the reality, a couple of ideas for you. If you really are enjoying a glass of alcohol now and again, even the American Cancer Society says a drink a day for women and 2 for men could be heart healthy and otherwise fine and not risky when it comes to cancer of any.
Are there any supplements? Is there any way to mitigate the effects of the alcohol?
Yes. So there are 2 great ideas I'm going to share with you. One is when you drink, choose red wine. Hopefully you like red wine, because the other, it just has poisons in it. And then the white wine is just a bunch of sugar that you don't need. So what's in red wine that's magical is resveratrol. And it's actually under study right now as a potential standalone cancer treatment. It's so potentially powerful. So resveratrol is very powerful anti-neoplastic antioxidant. And the other thing is red wine has an aromatase inhibitor in function. So basically that enzyme in your fat cells I mentioned, churning testosterone and others into estrogen, gets inhibited by red wine. So much so that there's a good study out that showed that women who consume red wine 4 to 8 ounces a day, not less and not more, versus teetotalers, those who drink no alcohol, actually had a decrease in all cancer-caused mortality. So choose red wine. The second weapon is something that's a beautiful supplement called Cosmo Companion that Pink Lotus offers. So Cosmo Companion is a carefully engineered, very brilliant formulation of methylfolate, that thing you're not making, with B6 and B12. So now you're also going to get that glutathione powerhouse in your body, mixed with a bunch of botanicals that support and protect the liver cells as they detoxify alcohol, and it accelerates glucose metabolism. So if you drink, taking Cosmo Companion like a daily vitamin, it will be very protective inside your body.
So it's not an excuse to drink. It's just if you do have those occasions when you may have one or more drinks, this would be a good supplement to take. It makes sense. And this is evidence-based medicine. This isn't, I'm selling a product. This is actually something that will help us. And everything I know about the kind of medicine you practice, it's all based on science. So we're going to geek out just a little bit more, and let's talk a little bit about TMAO.
Okay. Yeah, TMAO, trimethylamine and oxide.
And you'll explain it to our audience.
Yeah, okay. So this is an interesting compound in that it's kind of new on the scene, and it's tightly associated with a lot of killer diseases like heart disease and diabetes, but apropos to today, cancer, including breast. So what is TMAO? It stands for trimethylamine and oxide. And it's a very potent carcinogen made by the bacteria in your colon. And what are they using to chomp down and create it? Carnitine, which is found in all meat and dairy, and choline, which is found in dairy and eggs, okay? So you're not getting carnitine or choline from plants, but you're getting it from your animal proteins. And when you swallow them down and they shimmy their way to the colon, those little bacteria chomp it down and make TMAO, which is literally associated with an 81% increase in lethal prostate cancer in men who eat 2 eggs a week. Okay, so this is nothing that's innocent or should be ignored. It's new kind of in the cancer community, like really understanding it, but it is tightly associated with increased heart disease. Diabetes and cancer are big killers.
And what did the World Health Organization say about this?
Oh, you're talking about like processed meat?
Yeah, we're talking about processed foods and
yeah. Oh yeah, this is one of my favorite studies. I think I may have said that already about 10 other studies, but this really, really is, because it's not a study, it's a reporting basically. So the IARC, the International Agency for Research on Cancer, in 2015 met in Lyon, France. There were 22 researchers from 10 countries looking at 800 epidemiologic studies just to answer 2 questions. Does red meat cause cancer? Does processed meat cause cancer? And the answer was a resounding all processed meats. So we're talking sausage, hot dogs, bacon, but even your organic turkey breast deli slices, right? All those little salami, bologna, you kind of have an idea those probably aren't the best for you, but what about the turkey breast and the chicken breast? All of it, all processed meat is absolutely carcinogenic to humans, on the same list as plutonium, asbestos, alcohol. So that's what they said. They said to avoid all red meat, which is probably carcinogenic to humans, really, really strong evidence that it contributes to colon cancer, but definitely eliminate all processed meat.
And we serve it to kids in school. They get hot dogs, they get pepperoni pizza. It's just such an oxymoron that
I have a picture that I can't wait to show when it's actually funny, because I just took it. I took it like a year ago, and then I took another one because I got a better angle. And it's of the cafeteria at the major hospital where I work. And it's the morning breakfast bar. And I kid you not, tray after tray, it's just one banned substance after another. There's a tray of bacon, and then like, what do they call them now? The sausage patty slice, like the ground ones, those patties, and a bunch of hard-boiled eggs. It's one thing after another, just completely carcinogenic on the class 1 list, not the eggs, but the processed stuff. And there it is in the hospital cafeteria for you to serve yourself after your heart attack.
It's pretty amazing. It's pretty amazing. Okay, so we're going to take a little break now, and I'm going to bring Andy on. I actually took him out. So tell Andy, your husband, to come back onto the stream, and you are going to make your famous cancer kicking smoothie.
I am. All right, let's do it.
moment to make this transition, and Andy's going to come back on. As soon as I see him, I'll add him to the stream.
You're on. Okay. See you in a second.
All right. That's great. I hope everybody's enjoying it. I'm hearing a little bit of an echo, and I played around with the using headphones and not using headphones, so I apologize for that extra noise. But the sound is just not great today. I don't know why, but it was great the last time I did this 2 weeks ago, so I apologize for the sound. All right, let's see what's happening here. As soon as I see Andy Funk, he is going to film Dr. Kristi Funk making a smoothie. And I'm so excited. Let's see what's happening here. Oh, I think we have smoothie material. Look at that. Smoothie ingredients. And this is what's important about this smoothie is it's loaded with antioxidants, but I'm not going to talk about it. I'm going to let Dr. Funk talk about it. Why is this smoothie something you recommend for your patients and something I know that you and your family consume every day?
Okay, I can't wait to show you the smoothie. But Lisa, on my end, I'm getting a ton of crackling. Do we know if it's our filming or your side? You're breaking up, and I just don't want our audience.
I'm breaking up. Okay. Now I'm hearing some cooking. Is that from the phone? I'm not moving. I'm not touching anything. So I don't know where the crackling is coming from. Let me try. I'm not even touching my phone. I'm not touching anything. Is there something on the camera that Andy's using?
Okay. I'm not sure. All right. So this is my antioxidant smoothie, and
All right. Now I lost the sound.
What's that?
Okay, here we go. There we go. Okay. I don't know where your sound went. Can you say something so I can see if you're there? I heard you
before. I think we're good now. Can you hear me just fine?
Is there something on the sound, Andy, that because I heard her and now I'm not hearing it anymore. All right, there we go. Now I hear you. Now I hear you, but I don't see you. Okay, so let's get going with the smoothie and do the best we can. Can you hear now? You can hear me?
I can hear you. I can hear you.
You can hear me. Okay, I can hear you fine. I'm hoping our audience can hear as well. There's a clicking, and I don't know what that is. But let's just, yeah, and the audience says they can hear you. So let's start. Okay, go ahead.
Okay. All right. So this is a smoothie that I've been tweaking since 2012. Every time I found a new ingredient. So even before I wrote my book, I was smart enough to know that there was some power in plants. But now I'm way smarter, and this smoothie is the bomb. And I'm going to tell you each ingredient's power as we go. So we're going to start with a base of plant-based milk. Every time you don't drink soy milk, if you choose hemp milk, almond milk, etc., it's a fine choice. But soy is superior for all the reasons we already discussed, with its ability to decrease estrogen. And its anti-carcinogenic powers go beyond, because we're even seeing a 57% drop in estrogen negative cancer. So there's a lot of power in soy, and that's always my choice. Because when you drink something like almond milk, it's just a choice not to drink soy, and there's only so much milk you're going to put in your body any day. Okay? Next, 2 cups of berries. I use mixed berries. I use frozen berries. Gives the smoothie some thickness and some frostiness that I love. These berries are frozen on purpose. So I bought them frozen not because they can come in bulk and cheaper and organic and not break the bank, all very good reasons to choose them, but because actually the lysed cells, these little ice crystals inside the berries, already started the digestive process for you, essentially. So when you consume these berries, the power-packed polyphenols more rapidly get absorbed into your bloodstream and do their anti-cancer goodness. What is it exactly? There are chemical sounding names here. Anthocyanidins, proanthocyanidins, gallic acid. Okay, all of these compounds in your bloodstream literally seek out and destroy cancer cells. And there's a ton of fiber in here. So 1 cup of raspberries has 8 grams. The blueberries and blackberries have about 5 and 6 grams per cup. Fiber does a lot more than make for good bowel movements, although I will say that it binds excess estrogen and makes you poop it out. So it's a very important compound to get in your body. I want everybody getting 30 grams of fiber a day. Pathetically, 97% of Americans do not get a limpy 30 grams of fiber a day. And in this, we're already getting 15 grams just there. And I'll be right back. I gotta wipe my hand. Okay, another.
Tell us the connection between fiber consumption and estrogen.
So fiber actually literally is a estrogen binder. So it grabs it and then you just poop it out if you have excess estrogen. But fiber does a whole lot more than that. Again, back to that beautiful microbiome. All these bacteria in our guts love insoluble fiber, and they release compounds. We're just at the tip of the iceberg understanding how so much of health has to do with this body inside our bodies producing chemical transmitters that alter your mood, your weight gain and loss, your heart disease, atherosclerotic plaque. So fiber is its favorite food. So you want to be feeding your microbiome with fiber. Another source of fiber in my smoothie that adds some delicious sweetness is a date. So dates have a lot of antioxidant power as well, so we'll throw that in. Oh, but you know what I wanted to tell you? I wanted to tell you that if you're like, okay, Funk and your smoothie with all the ingredients, if you're in a rush and you still want a smoothie, if all you manage to throw into your blender is the milk, the berries, 2 cups of berries, and 2 fistfuls of the almighty greens. Here's some organic kale. I'm going to shove a fistful in here. And here's some organic spring mix, $5 for a huge box. Very economical smoothie, right? Like, this is not stuff that's going to break the bank. If that's all you can get into your blender because you got to go, you already have a nutritional powerhouse here. Why? Because greens are so powerful, as are berries and the soy base. So what's in greens? There's another chemical. I'm just trying to impress you with all my chemical names. Isothiocyanates, like it just rolls off my tongue. But these chemicals, you chew, you swallow. Can't cook them. You'll destroy the enzyme that does some magical transformation of the ITCs that I just said into sulforaphane. Sulforaphane, again, seeks out and destroys cancer cells, causes apoptosis, which is a fancy doctor term for cancer cell suicide. So 2 fistfuls, 2 cupfuls packed of greens, milk and berries, and you're good to go. But if you really want the bomb, listen on. So what else do we have here? Oh, you'll never know what this is. Amla, A-M-L-A. What is Amla? It is the powdered form of the Indian gooseberry. And why, oh, why does this deserve a place in my blessed smoothie? I'll tell you. There was a great study looking at over 3,100 foods. They compared the antioxidant power in these foods, everything from like Coca-Cola to coconuts. And the tippity top, the top food, top antioxidant power, 124 times the blueberry, was the Indian gooseberry. You could probably find a specialty shop that might carry it, but I haven't. But Amazon gets you organic amla powder, and we put that in smoothie. Okay, so it's the Indian gooseberry. Another fun ingredient we have here that you have heard of, but might not cook with enough, is turmeric. So turmeric's power is curcumin, although there are more head-to-head turmeric versus curcumin. Turmeric has more anti-breast cancer properties. So you can use straight curcumin, or you can use a 1/4 inch of turmeric root, the actual fresh root. But the power in turmeric is unbelievable as an antioxidant, also to basically interfere with cancer cell chatter. Like they're talking to themselves. Wait, did you say to grow? No, I said to die. Okay, apoptosis. So we're back to the cancer cell suicide. Ton of that, anti-inflammatory, and it's hyperactivated, basically 2,000 times more bioavailable with the addition of pepper. So there is a 1/4 teaspoon of pepper to get the piperine in there to combine with the turmeric to make it oh so powerful. It's also fat transported, absorbed, so we need fat. And where we're going to get fat is a tablespoon of ground flax seeds. This innocent seed has so much power. Again, comparing, what about hemp? What about chia? All delicious plant-based sources of healthy fats, but this is the king. The king of what? Omega-3 fatty acids. This is the most concentrated source of healthy monounsaturated omega-3 fatty acids on the planet. And those fats are going to take that turmeric with that piperine and bye-bye cancer cells. Lignans are in here, 200 times more concentrated in flax seeds than any other plant food on the planet, insofar as we know. And what are lignans? They are powerful anti-estrogens. So again, we're getting rid of the cancer fuel for 80% of breast cancers by just dumping some flaxseed. Oh, I got a great study. It's my favorite study. Kidding. But it's a great one. Biopsy-proven cancer, okay? All these women, half of them got a flaxseed muffin a day. The other half got a fake-out muffin. I'm not advocating for muffins. That's like terrible vegan food. But anyway, they ate a muffin. And some had flax, the other half didn't. 3 weeks later, they had their surgery. Their cancers were removed. And the sample that diagnosed the cancer had something measured called the Ki-67. It's a proliferation rate. It's a division rate. The answer to the question, how many cells here are actively dividing, one becoming two? It's a percent from 1 to 100. 1% division, your cancer is a couch potato and is never going to kill you. 90, 100%, this is a bad actor moving fast, right? 3 weeks later, only difference, flaxseed muffin or another bad muffin. The Ki-67 in these tumors of the people who had the flaxseed muffin went down by 80%. Just flax has the power to like basically put the brakes on cancer. I'm not advocating for you to take
prefer, so you prefer the ground. So you prefer the ground flaxseed over certainly over whole flaxseed because it's not absorbed. And then how does that compare to chia seeds and hemp seeds? Is it that the latter two don't have lignans?
They don't have as much lignin packed into it, and they don't have as many omega-3 fats. So again, it's just you're only going to chew and swallow so many calories. You may as well get the most bang for your buck and your calorie buck. Ground flax. So the hulls are really hard and they don't get absorbed. You will poop your flax out unless you grind it. A Vitamix like this will grind a hull, but honestly, we go through bags and bags because all 5 of us are having flax every day. So there's no reason not to have it ground. It will keep well in your fridge for 3 months and then go a little bit rancid. So we go through a bag a month though. All right, my next.
Okay.
Green tea. This is matcha powdered green tea. And I will tell you, so, okay, again, to impress you, it's the EGCG, the epigallocatechin in green tea that stops the production, the proliferation, and the metastatic potential of breast cancer cells. So the EGCG in here is so powerful that those who drink 3 cups of green tea a day have 50% less breast cancer. Those with stage 1 and 2 early stage breast cancers who drink 3 cups of green tea a day have 57% less recurrence. And those in later stage 3 have a 37% decrease in recurrence of their cancers, just isolated in these studies to the green tea consumption.
Are there any drugs, Dr. Funk, drugs that do the same thing as green tea?
Yeah, chemo.
So you have a choice, chemotherapy or green tea. And I think it's great that you talked about matcha because matcha actually is the powdered leaves that you consume. And one of the things we've discussed before is to simply just take an organic green tea in a bag, open up the bag and dump it in your smoothie.
Yeah,
and
I do that. I cut the leaves and throw them in from the bag when I run out of matcha, which is fairly expensive, the matcha. So tea is cheap, the leaf. Confessions, I don't really like green tea that much, but I will have some in the smoothie. And then at noon or 1 o'clock every day, I've done my coffee drinking. And then I move to the tea. And I just put 3 cups all together. You squeeze lemon in, that bumps the antioxidant power of the EGCG 5-fold. So green tea, lemon squeeze, plug, and shut. Done for the day. Okay. This is so fun because you don't know about this one either. Aloe vera gel, inner fillet only. This is not aloe water or gel juice. It is the inner fillet. It's kind of thick and gummy gooey. It has these 2 chemical names that decrease inflammation. And you know that, right? Because you put aloe straight from a plant onto a sunburn because it's anti-inflammatory. And it's doing the same thing inside your body. So this is a
magical smoothie. It's magical.
Okay, we got
It's
two more
science-based, but it's magical, I think.
Okay, so this is cinnamon, and you probably are well aware of its anti-inflammatory power, and it's oh so delicious in the smoothie. Bananas have a little fiber, but they also have something called rutin, which is another anti-inflammatory. So we're really squelching the inflammation in our bodies, which of course is caused predominantly by our animal protein consumption, but it's also just part of life to have inflammation. Emotional stress will cause inflammation. And I know many stressed out vegans, so there you go. Oh, the lid is in the dishwasher. Hold on. Okay. All right, we're good to go, ladies. And
all right,
good men are watching us too. So I'm going to turn this on. We're going to start kind of low and hit go. Boom, and we're done. So this one,
I like to tell everybody that the Vitamix blender tends to be pricey, but you can get refurbished models directly from Vitamix, and they're less than $300 as opposed to the brand new ones, which are $450. So I think this is a great tool. If you look at the amount of money you spend on copay, seeing doctors, and certainly suffering from chronic diseases, this is really a medical tool, and I think insurance can cover it.
So when you have more raspberries, you're going to get a purpley, you can even get a red color to it. When I do more greens and more darker berries, it'll look like this kind of not that appetizing brownish color, but it's still completely delicious when you drink it. This one turned out a nice purpley blue. Mmm.
That's wonderful.
I can feel those cancer cells dying inside my body. All right.
That's great. All right. Well, let's continue. We have a few more things we want to cover. Thank you so much for making the smoothie. And we're going to put that recipe, we'll post it to the comments on Facebook and YouTube. And I got to figure out how to do that on Twitter so you can actually see the whole recipe. I will post a link to the recipe in the comments when we're done. And that way you can see the entire, it's a document that will go to Dr. Funk's website, and it will have a link to the recipe. All right, there we go. You're back.
I'm drinking my coffee, black.
Yeah, you are. There you go. Okay, so I'm back too. All right, that's great. So there's a lot of controversy about mammography and whether or not we should have mammograms. There are some physicians in the plant-based community that are actually against mammograms. I don't really understand it. I'm assuming because you're a breast cancer surgeon, you're pro mammograms. Can you talk a little bit about that? And I've learned recently from you that there's now something called a 3D mammogram that may be a little more costly, but you can explain, if you could please explain what the benefit is of having that and why someone would have this 3D mammogram.
Okay, so a lot in there, but basically, my plant-based colleagues are not wrong when they're not liking mammos and saying they cause cancer. They do. So if you take women starting at the age of 40 and give them a mammogram every single year, and you take 10,000 women, you will cause 8.6 breast cancers from the radiation exposure. But you will have found 860 cancers. You find 100 times the cancers that you cause doing screening mammography. We still should advocate for better screening that doesn't have any adverse effects, but this is what we've got. This is where we are. So those are the stats on cancer causation from mammography, which can calm someone down to realize it's not astronomically high. There is also nothing in the cancer itself that says like, hi, I was radiation induced. So you won't know if you get breast cancer if it was from mammograms or maybe all the processed meat you were eating. So that's that. When we talk about mammography, when to start, when to stop, how often to get it, a lot of confusing recommendations from very reputable institutions, everything from the American Cancer Society to the US PTF, they all have different recommendations. And it's based on groups of individuals who are not on the front lines of diagnosing or treating breast cancer. They're epidemiologists and some money crunchers, they're looking at cost benefit analysis. And it's not just money cost, it's the cost of, oh, your mammogram shows something, come back for more views, more radiation. Oh, we need to biopsy that. Oh, it was benign, fake. So, you know, those little fake outs, those false positives cause a lot of time, money, anxiety, lost work. I mean, it's nothing to just, you know, shrug over like I just did. But if you ask women, okay, if you ask women, how many lives need to be saved? How many unnecessary mammograms do you need to do to save one life? You ask that question, which they did in a study. Mm-hmm. The basic answer was 5,000. I would accept 5,000 unnecessary mammograms to save one life. And basically these guidelines are answering that same question, but they came up with a much lower number. So they would say 1,300 mammograms could save one life. So in order to get to that stat, you shouldn't start mammos till you're 50. Well, 20% of all breast cancer in women in the United States happens under the age of 50, 5% under the age of 40. So basically from that number, you can realize 40 is about when the uptick starts. So the American Society of Breast Surgeons, of which I am a proud member, and I agree with their stance, says begin mammos. After discussion with your doctor, it can be individualized, but we say begin mammos age 40, don't stop and don't skip years until you plan to die in the next 10 years. Because then it's hard to predict your death date, but you can know if you're on oxygen in a wheelchair with bad heart disease, you can skip your mammo, or go plant-based and shock your friends and live 30 years. The other 3D, yeah, okay. So 3D, also known as tomosynthesis or TOMO for short, is a newer way of looking at the breast. So if your breast were a loaf of raisin bread, who doesn't think of her breast that way, and you squashed it and took a picture and told me to pick the raisins out, that would be possibly doable. But what if you sliced that bread 10 to 15 times and pulled the slices out one by one? Now I can see all those raisins. And that's what 3D Tomo does. So this is an excellent option for the 50% of American women with what we term dense breasts. It has nothing to do with how they feel lumpy and bumpy. It's actually a radiologist, a breast imager's interpretation of what your mammo looks like. And if it looks white and splotchy versus darker black gray, which is more fat than breast that actually gets cancer, milk ducts and lobules. If it's brighter white and splotchy, it's dense. So we grade it A through D. And if you're a C or a D, you have more dense tissue than you do fatty. And because of that, two problems. Problem one, cancer's white. So now you're looking for a snowball in a snowstorm, more likely to miss it, or that raisin in the raisin bread. And number two, you have more of those elements of the breast under your breast skin, the stuff that actually makes the cancer. It's next to never the fat and the ligaments and the stroma. It's always lobules and ducts, and that's making it dense. So now you have a higher risk of breast cancer, and we're worse at finding it. 3D versus your typical digital finds cancer 34% more often than does 2D. So if you took 1,000 women, you're going to find 8.1 cancers with 3D and 5.3 with 2D. So it's better if you're dense breasted, not necessarily A or B. Sometimes when you go, your insurance won't cover it. They'll cover the basic mammo price and you've got to pay cash for the 3D option. So if you're not dense breasted, save your pennies. And and there are 17% fewer callbacks for those false positive, anxiety provoking, like, oh, I think we see something. Psych, it was nothing. Sorry about that. So there's lots of that and more cancer detection. So if you're dense, get 3D. If you're not dense, don't worry about 3D. Don't pay the extra money, but if you can do it, why not? And little tip, if the closest 3D machine is like 50 miles away, know this, head to head, 2D plus whole breast screening ultrasound was identical to 3D in cancer detection. So if you don't have access to 3D, get the usual mammo, but ask for an ultrasound if you're dense breasted.
Good. Let's talk about breast self-exam. How many women actually do it? Do we know?
We don't know, but most don't. For sure, most don't. And they don't do it regularly and they don't do it properly. And neither do most doctors because a good breast exam just isn't part of the training for some weird reason. And here's the stats. The stats are that women doing their own breast exams find tumors the same size that a mammogram will find a tumor. A national average is 2.1 centimeters or nearly an inch. So that gives societies the power, the what's the word, the reason to say, you know what, ladies, forget your self-breast exam. I say not so fast. I say, you know what, I have met far too many cancer patients who did in fact find her own cancer. It may not have been a self-breast exam. Oftentimes it's literally scratching an itch or soaping up in the shower or putting lotion on, but they feel a new bump and they find it, and their doctors can find it. So I don't appreciate that they're saying my job is useless, which is doing clinical breast exams, because many a gynecologist has felt a little something that may be nothing, but let's go just check it out, and lo and behold, it's cancer. So I don't agree with the idea that just stick to the routine imaging and don't worry about it. I think that as soon as you start menstruating, you should start self-breast exams. I have a fabulous 4.5-minute video that I created to help people understand exactly what to do step by step. You can find it at easybreastexam.com. It's just a link to the video. And what you'll see there, might surprise you. Like, for example, you start your breast exam by disrobing from the waist up and looking in the mirror and then flexing. Because when you flex and you pull on your pec muscle, if there's a cancer deep down there, it's going to go back and then your skin's going to dimple in. So I've got little tips and tricks on how to do one. Why? I don't think a 12-year-old's going to have breast cancer, but I want her to know breasts are natural, they're changing, they're growing, they're part of you, you're with them 24/7. Your doctor is not, and you should just be familiar with them. And if you're doing a monthly self-breast exam, heaven forbid you feel something new, your fingers develop this little memory of the bumpiness. And so if there's something new, you'll be like, that was not there before. And you'll be wise to your own body. So I like self-breast exams.
When is it best optimal to do it during the month? If you are going to put it on your calendar to remember, is there a time during the month of the menstrual cycle that's best?
Yes. So when 7 days after your period starts, so day 1 is the day you bleed. 7 days later, your breasts are the least tender and less lumpy than other times. So it's not so difficult. And you don't want to do it multiple times a month because your breasts change. The terrain gets lumpier and more tender, and you're going to think it's something because it wasn't there last week, but it's actually just the normal change for that week. So pick the same time 1 week after. And if you don't menstruate, if you're menopausal, pick the first of the month so that you can just cross it off your calendar and you know you did it that month.
That's very good advice. And I'm going to take the link and I'll put it with the other links. So we've got a link to the breast cancer video. We have a link to the smoothie. And then we're going to talk about the Cancer Kicking Summit. Let's talk about
So
and I'll have a link to the Cancer Kicking Summit as well, because I can't wait. I would have gone, but it was in April and it got canceled. So
thanks, COVID.
Now it's going to be in October, the 3rd and the 4th, at a beautiful resort in Palos Verdes. Tell us about it.
Yes, the resort's called Terranea, and it is absolutely gorgeous. So you walk in the front doors and you're like, when did I get off a plane to Hawaii? I mean, it's just completely alters your state of mind to one of like peace and serenity and energy. And this is going to be a 2-day retreat for women and men. Spouses can come, they can join the retreat, or they can go golf. But it is meant to be a deep dive into the soil of your life. We go way beyond eating, although you can bet that I'm going to talk about food, but there's more to your life than what you're chewing and swallowing. It's what you're doing, how you're moving, literally with exercise or just daily motions. A lot of work on thinking. What do you tell yourself about yourself? And why do you say those things? And how long ago did you start believing those things? Because are they true? And why do you hold on to them so tightly? And why do you define yourself by that? Because if you become not that, if you are a big lady, if you're plump, if you're chubby, but that's who you are, then will you not be you if you lose weight? Is that part of your mantra, right? So we go really deep into the soil of your life. I have 10 trees that I want planted into your soil to create an orchard of your life that will be yielding the most fruitful, bountiful existence possible. A life that has purpose and meaning, that is very connected with other people on this planet, so that you really become who you were meant to become, doing the things you were meant to be doing and doing them with purpose, with power, with joy, with impact. It really is going to be a tremendous weekend of camaraderie and love, and it's very high energy. So So dang it, COVID, stay away, because I'm not doing this one online. It needs the energy of the room, and it needs the beauty of and serenity of the ocean for this to be the transformative, powerful, life-altering 2 days that I know it will be. So please join me. And it's not just in person, by the way. It is on-demand video. So if you can't come, you can join us via video, and there will be a lot of outdoor stuff that brings you outside with us so you can get some of that awesome California sun and ocean also. It's going to be great.
That's really great. I'm going to put the picture up here for a moment. Let's see if this goes up. Let's go up. There we go. So we've got the Cancer Kicking Summit. There we go. Let me take down the banner so we can see it. So,
and basically, if you get confused and you just go to pinklotus.com, it's all navigable. You just go up to those top things and you'll find yourself in the Power Up community, where we've got a ton of online, over 10,000 women online chatting away, doing little groups and questions and answers. And oh, you know, can we talk about breast buddies? That may be really
yes. I thought that was my next topic. I think it's so amazing. I spent a fair amount of time on your website, and it is so supportive. You have everything from certain kinds of items for women who've just had breast surgery to make them more comfortable. You've got items to make nursing more comfortable. You've got some supplements to make menopause more comfortable, and you've got your companion item. What is it called? The
breast buddies. Yes.
Yes. So, and then you have your breast buddies, which is support. Why is it important for women to meet strangers that also have breast cancer? Can you talk about that?
It's important on multiple levels. I'll tell you, there's a study, LACE, L-A-C-E, Life After Cancer Epidemiology study, that looked at 2,400 breast cancer thrivers who had not recurred, and they followed them for 8 years. And those who reported low, not high, low psychosocial support and no or low religious affiliation so they just basically didn't have a support system in their lives, had 58% higher mortality 8 years later from breast cancer than those who reported out high social connectedness. So that is important. And not everybody comes to a cancer diagnosis with a BFF. And even if you have a best friend, if she didn't do exactly what you're about to do, she doesn't get it. She'll be supportive and a friend and loving. But what is beautiful about breast buddies is you go in there, you just sign up, and then you'll put in, it's matched age for age, stage for stage, treatment for treatment, so that like is speaking to like. We don't need a stage 0 in situ cancer woman who might have to do a mastectomy and is very worried about that, pairing up with this stage 3 cancer with 8 positive lymph nodes who did chemo and mastectomy just because she wanted to talk about mastectomy. Like, that is going to create fear in her that's completely unnecessary for her future journey. So this system, you'll put in DCIS and like Match.com, all the women who are on there who have been there, done that, they're past that part of the journey. They're there because they want you to reach out to them. They want to be a source of Q&A, of a cup of coffee and just chatting, of flashing what a mastectomy reconstruction might look like. So these are women who want to be there as a source of comfort and love and information. So the more parameters you put in, the narrower it gets. And it's done by every 5 years, so that you got someone around your age. And then you see, oh, wait, she's got an 8-year-old boy too. I want to talk to her because I want to know how to tell my son. So that's Breast Buddies. The store that you alluded to, Pink Lotus Elements, is chock full of really, when possible, they are like randomized controlled trial kind of vetted supplements. There's nothing in there like kitschy pink ribbon earrings or anything. Nothing wrong with those, but that's not what the store is about. It's about vetted products that over my 20 years of doing this, I've come across as really being helpful and scientifically shown when it's a supplement to help. And chief among them, our bestseller, is definitely Menopause Miracle, because that has a number of 3 randomized controlled trials in women with estrogen levels drawn that proves it doesn't increase estrogen. They've looked at the liver impact of Menopause Miracle, and there isn't one, which is very important because herbs often impact cytochrome P450, which is in the liver that metabolizes drugs to their active form or inactivates them, and herbs can rev it up or change it. And now your medical oncologist is like, don't take herbs because we don't know what it's doing to your tamoxifen or whatnot. The Menopause Miracle is completely safe and, most importantly, crazy effective. Like, it lives up to its name as a miracle on all levels: hot flashes, night sweats, vaginal dryness, mood swings, itchy skin, insomnia. It's amazing. So that's a good alternative for those who are not supposed to be taking hormone replacement therapy.
And there it is.
Ah, the miracle.
It's the miracle. It's absolutely the miracle. It's so interesting because so many Asian women don't even have a word in several of the Asian languages for hot flashes. And,
right.
And they're
soy and green tea, people. Soy and green tea.
Yes.
And herbs, right? Like these Asian herbs is 3. Menopause Miracle is just a 3 Asian herb blend. That's all that's in it. And Asians, they tend to have an ideal body weight, so they're not overweight, and they consume more green tea and soy in the form of, tofu, miso, not tofu.
They do. There's so many, thank you so much for joining us today. I'm sorry we had some difficulty with the sound, but we had pretty good viewership. And I just want to ask our audience to please share the video, because I think everybody, I don't know anyone who doesn't know someone, a family member, a relative, who's had breast cancer. The numbers are astonishing. Is it still 1 in 8 women?
It still is. Yeah. About 268,000 invasive cancers every year. 41,000 women die. So although it is getting diagnosed at earlier stages, so thankfully more women are living longer, full lives, and not dying from their breast cancers, they're still getting breast cancer, and the rate is going up a teeny bit year after year. So we need to put a lid on it with healthier food choices and better lifestyle choices in terms of eating a whole food plant-based diet, maintaining an ideal body weight, exercising regularly. And by that, I mean 5 hours a week. If you're going to be able to carry on a conversation, if you get super sweaty, you can drop it in half, 2.5 hours a week of vigorous exercise, and minimizing or avoiding alcohol. Those are going to be your big 4. But then handling emotional stress, shying away from hormone replacement therapy, and doing a deep analysis of where your environmental toxicities are in your home, in your car, in your work, and minimizing or eliminating those are all going to go miles and miles away from cancer and not toward it.
It all adds up. So we can make healthy lifestyle choices. And that is the reason we're doing this show. Hey, Doc, what's new in plant-based medicine? So now the audience, all of you, know what's new. And I'm sure you've learned multiple pearls of wisdom to share with your family and friends. Please share this video. And Dr. Funk, I hope you'll come back with us and we'll continue doing this. I'd like to do another show and we'll talk about the Cancer Kicking Summit that's coming up October 3rd to 4th. I'm going to be there and I think you're going to sell out. But if you do sell out, people can watch.
Almost is sold out. Most people are just transferred April to October. So it'll be fun.
Oh, your dinner's sold out. Yeah, it is. Yeah. It's going to be powerful. It's going to be a very powerful weekend. So please look up, give me a few minutes to put all the links up and I'll put them onto the various social media platforms. We're broadcasting to Facebook, to Twitter at JVM, and to YouTube at Jane Unchained News. So thank you so much for joining us. Thank you, Andy Funk, for being the cameraman today in the kitchen so we could see the cancer kicking smoothie. I just think if you just do one thing that Dr. Funk talked about today, your life will be better. Thank you so much for joining us. I'm Lisa Carlin, and I will see you next week on Friday at 10 a.m. And have a great weekend, everybody. Bye-bye.